Hi, I'm Dr. Chip Cole. I'm a quadruple board-certified oculofacial plastic surgeon, and today I'm going to talk about lazy eye surgery. A lazy eye can be fixed, fortunately, with surgery. Usually the muscle is very weak in the eyelid, so we attach what I like to call little suspenders from the eyelid to the eyebrow, and so it's the normal function of the eyebrow that assist the eyelid to move up and down. The best surgical procedure for a lazy eye is really dependent on the muscle function. If a person has some muscle function, we always try to maximize the use of the muscle in the eyelid. If the eyelid muscle does not have very much function, then we borrow the normal function of the eyebrow by putting in little suspenders under the skin or muscle that you do not see, so that when the eyebrow moves up and down, it assists the eyelid in moving up and down. A lazy eye is considered an urgent type surgical procedure. It's not a medical emergency, but it's something that you want to fix very early if it blocks the visual development of a child. I have had children as young as 2 or 3 months that I have done a procedure on because the pediatric ophthalmologist was concerned that they weren't developing vision in that side. Yes, a lazy eye can be repaired in an adult. It's primarily for aesthetic reasons because the visual system has already fully developed. Please make sure to subscribe. The recovery for lazy eye surgery is fairly brief. At about 1 week, you're about 85% healed, and the remainder heals over the next week or 2. When you have lazy eye surgery, as an adult, we keep you awake with a little mild sedation. As a child, it's a little more intimidating, so we usually put you under general anesthesia. Lazy eye surgery is typically covered by insurance because we're trying to take something in an abnormal position and put it in a normal position with hopefully normal function.